Hi everybody, Marsha Wykes here again. I'm a physical therapist here at Chiafretti & Associates, and as you can see, I'm back in the office, so there will be no cats or dogs making guest appearances in today's video. I'm sorry to disappoint you about that. I hope you had a chance to run yourself through the self-assessment stuff about the hips regarding the strength and flexibility and control and all the things we talked about last time. So today I'm hoping to touch on how to address each of the things you may have discovered about yourself and how to work on correcting those things to make them come more in alignment with normal biomechanics. So if you remember, we talked about the squatting and lunging movements and making sure that your knees move straight ahead in the same direction as your toes are pointing. No matter whether you're on 2 feet doing a squat or 1 foot doing a lunge, you want to make sure that knee is pointing forward. So if you found that it's not, something you can work on with your resistance band, if you have one, is to tie it around just above your knees, just in a snug, and usually a bow makes it easier to tie and untie. And you see how that's pushing my legs together, okay? But if you step your feet apart, you're going to feel it want to push your knees together, which is going to trigger your brain into thinking about how to keep that apart. And that's what we want, is those muscles on the side of the hip to work to keep your knees apart. So your job when you're working on your squats, if you're doing it with the band on, is to fight the resistance and not let the band push your knees together. So even if you don't have a band during boot camp, if you practice with the band at home, you're going to get some of that muscle memory and help your body be able to remember that you always want to be pushing a little bit outward as you come up and down into your squat. So looking from the front view, you see that my knees are aiming over my toes, okay? Looking from the side view, you want to remember that you're trying to fold your hips back and not think about pushing your knees forward. So I'm pushing my rear end back behind me as I come into the squat, okay? Instead of thinking about pushing my knees forward over my toes. When you push your knees forward more than put your hips back, it increases the stress or the strain to the front of your knees, okay? So that's one thing you can do with the band to work on that control. I'm going to leave the band on and talk about some things you can do to work on some of the strength issues that we found. So I'm going to lie on the table here. At home, you could certainly just do this lying on the floor or on your bed, okay? So we used this as a little bit of an assessment last time. We worked on kind of checking your mechanics with the motion called clamshell, okay? So you can do this as an exercise. You'll keep your knees bent at about 90 degrees and your hips bent at about 70 or so degrees. And you want to have your top hip rolled forward a little bit to prevent you from kind of reclining back this way. Because when you recline back this way, you use a muscle on the front of your hip more than the muscle on the side or back of your hip. So if you keep the pelvis rolled forward and work on opening that top knee only as far as you can without letting that pelvis roll back. So we do not want the backwards motion. We want to keep that forward and work on just opening up the knee like that. So I have my patients work on this in groups of 10 to 15 repetitions or until fatigue. So if you're aiming for 10, but boy is it tired at 8, you're going to stop at 8 and give it a break, okay? The place where you should feel that working is going to be kind of right in here at the back pocket of the hip. And the muscle that you're working is the one that prevents the knee from rotating in this way. So you're working on keeping the ability to keep your hip rotated outward, which prevents that caving in from happening when you're doing the squats, okay? Another way to work on that same control and muscle group is in this position, sitting. So just sitting in a chair would be perfect. You'd put your feet about hip width apart, okay? And you're keeping that outward pressure on the band, and you're working on the movement of coming up and down from your sitting position, never letting those knees collapse together that way. You're always keeping pressure on the band, okay? If you find that your chair is too low and it's causing you to have knee pain, or it's too hard to get up without using a bunch of momentum, which we don't want, then you either need to find a taller chair, or you can put an extra cushion from your couch or something underneath you to boost you up a little bit. The higher the seat of your chair is, the easier the movement is going to be, okay? And then your goal would be to work toward a lower and lower chair, lower and lower stool, and still be able to maintain this parallel position. So my feet, my knees, and my hips are all kind of an equal distance apart from each other as I move up and down through the motion, okay? Another thing to work on with the band, I'm going to try to cover all the band things first just to make it easy. We'll be using the band while you're working on your bridges. So we sometimes do bridges at boot camp. That's where you're laying on your back and you're lifting your hips up off the floor, okay? So if I lie on my back and I keep the band on in this same position, bring my feet about hip width apart, just like we did for the squats and just like we did for the sit to stands, okay? And keep that outward pressure on the band. Now what I'm working on in the bridge is using my belly muscles, so pull that abdomen, pull that core in, belly button towards your spine, just like they talk about in class. Squeeze your glute muscles to help lift you. But the purpose of the band is so your brain is still thinking about pushing out and using those muscles on the side of your hip. So keeping the band on, coming up into the bridge with your tummy and butt muscles tight, pause for a few seconds, and back down. So all of these work on the same idea of controlling that parallel alignment of the hips, knees, and ankles, okay? All right, I think that's all I had with the band. So I'm gonna take that off. We'll talk about some of the flexibility and stretching things. So we talked about how to figure out if your hamstrings on the back of your thighs were tight and how to figure out if your hip flexors were tight. So I'm going to review a couple ways to work on stretching those things. There's about 100 ways to stretch them, and we got to find just a way that'll work for you, so I'll give you a few examples. The foam rolling that Sarah has taught is a perfect mechanism for working on the tissue mobility of both of those structures. So if you've already been working on foam rolling, keep it up because that's really important. And if you haven't worked on that yet, make sure you watch Sarah's videos about the foam rolling, okay? But if you have a yoga strap or a dog leash or a belt from your bathrobe or something, that would work for some of these things I'm going to show you. So if you take your belt or your strap and loop it around your foot and come on down to lie on your back, you're going to leave the leg that is not looped by the belt down flat. And you're going to use your hand to work on lifting that other leg toward the ceiling until you feel a pull or a stretch in the back of your thigh or back of your knee. And if you wanted to combine this with a calf stretch, you could pull your toes toward your nose a little bit and you're going to feel it all the way down your leg. What you need to make sure of though is that this other leg is staying flat down on the table, because if that wants to pop up like this, then all of a sudden you're not getting as much stretch and you're going to have your leg way up high. So keeping that down, make sure that your pelvis is staying neutral and you're keeping your knee straight and you're lifting that leg until you feel the stretch. So when we're warming up for boot camp, we use dynamic warm-up and stretching exercises. So we're moving in and out of a position, getting the muscles warmed up and loosened up. This kind of stretch that I showed you with the belt is more about gaining muscle length. So this kind of stretch you're going to want to do, say, after boot camp is done, when your muscles are nice and warm and loose, or even at the end of the day before you go to bed. Just ways to work on gaining muscle length. It's not the best way to get warmed up for a class. It's better to do those in a dynamic format like we do at boot camp. Another option for stretching, I'm going to have you move to the side for this one. For stretching the hamstring would be sitting up in a chair, sitting really tall with one leg out straight in front of you. And the tendency when people think about stretching their hamstrings like this is they think about bending over and bringing their head down. And that's not what we want. Because you want to think about the fact that your hamstring runs from kind of the middle of your buttock down just past your knee And when we do the exercise, we want to think about lengthening the space between the buttock and the knee, okay? So in order to lengthen that space or move my butt further from my knee, I'm going to hinge forward at the hips, pressing my chest forward, like I'm trying to bring my chest toward my toes, as opposed to this way, which is really bending my spine and not doing a whole lot for my hamstring, okay? So you'll find if you're keeping your spine really straight and pressing your chest forward, you're going to feel that stretch pretty quickly going down the back of the hamstring. And you could stick this in throughout the day when you're sitting down. It's an easy one to stick in, okay? Then we talked about tightness in the front of your hips or thighs. So in order to stretch that, there's a couple different versions. One would be standing. So if you stand in a position like you're getting ready to do a lunge, you could be next to the counter or something stable to hold on to make sure you don't lose your balance. But in this standing position, if you think about kind of tucking your butt under, okay, kind of tilting your pelvis, what you're trying to do is kind of spread open the front of the hip or elongate the front of the hip. So just by tucking my pelvis, I can create a stretch right there in the front of the hip. Some people get some back pain when they do it in this position. So if you get back pain, this is not the position for you, but it's something you can try. The next option would be coming down on one knee. You could certainly put your knee on a pillow so that it was softer if you have some problems with putting weight on your knee, but it's the same idea in that position. Tuck your butt under and press your pelvis forward, thinking about spreading and opening this part of your pelvis, this part of your front of your thigh. That's stretching the hip flexors, okay? A third choice for stretching the hip flexors would be lying down on your bed. So if you lie on your bed and move yourself all the way over to one side, okay? Get yourself a little diagonal so you don't fall out of the bed, because I don't want to be responsible for that. But if you put yourself a little bit diagonal and let that one leg come off the bed, I need my table a little higher, but you'll have to imagine. If I let that leg hang down off the bed, you may already feel a stretch there if you're tight, just by having this knee bent up. If you don't, then what you're going to do is add in hugging that other knee up. And I can feel a pretty significant stretch there. Even though for me, I don't necessarily test out as having really tight hip flexors. They must be a little tight, because I can definitely feel it stretching. But it feels pretty good. So you would have to scoot over to the other side of the bed to do the other leg, or flip yourself around the other direction. But this is a nice passive way to work on the stretching, okay? And a fourth way to work on it would be back to the yoga strap. We're going to put that, I'll maybe it on this leg so the camera can see. Put that around your foot, and you're going to get on your stomach. And we tested it this way. So you'll remember when we tested it, I talked about as you bend your knee, bringing your heel up toward the center of your buttock, you wanted to keep your pelvis flat. You didn't want to see any kind of poking up of the hips like that. So get yourself settled in flat, and then pull that belt with your heel aiming toward the center of this butt cheek until you feel stretching in the front of your thigh or front of your hip, okay? This gets a little further down into the quadricep muscle, but if your hip flexor is tight, you will feel it there as well, okay? The mistakes people tend to make with this one is they get their leg kind of pointed out here to the side a little bit. They're kind of rotating their hip outward. So make sure that heel is coming straight up toward your buttocks, all right? So those cover stretching the hamstring and hip flexors that we talked about. The stretch for the piriformis muscle, which is here kind of in the buttock that we just worked on with that clam exercise, is lying on your back. The leg that you want to be stretching is going to be crossed up top, okay? Kind of like you're sitting in a chair with your legs crossed. And then you can use your hands, or you could use your belt if it's too hard to reach with your hands. You could loop your belt around your other thigh, and you're going to use that belt to pull your legs towards your chest until you feel the stretching in the buttock or the hip flexor here. If pulling is too hard because it's hard to reach your leg or your arms are a little bit weak and that makes it just challenging or difficult, what you could do instead is find something like a little box or a dictionary or phone book or something, if anyone has those laying around anymore. If you put your foot up on the box before you get your leg crossed over, you're going to feel the stretch there because putting your foot on the box brings your thigh up a little closer to your head anyway. Okay? All right. Now we're going to talk a little bit more about the squatting. So if you have your wooden dowel, you're going to take your wooden dowel and you're going to put it behind your spine with it touching your head and your tailbone. Okay? So one hand is up above your head and one hand is down by your buttocks. It doesn't matter which hand is on the top or the bottom. Okay? You're going to keep it against your spine like that. And I'm going to show you a side view of the first component I want you to work on. We talked about how you want to be pushing your hips back when you squat. So we're going to learn that first with the movement called hip hinge, which is, we work on this in boot camp with the waiter's bow exercise, okay? So you're going to think about keeping your head and your tailbone on that stick, and you're going to work on hinging forward, bringing your chest toward the floor and sticking your rear out behind you, okay? You can see that the stick never leaves my head or my tailbone, and all the movement right now is coming from my hips because my spine is staying straight and my knees are staying straight. This is just learning the first component that we're going to incorporate into a squat, okay? The mistakes people make with this is as they come down, they'll start to round their back, and when I round my back, look at what happens to the stick. It leaves my tailbone. That tells me I'm not keeping my spine straight, okay? So if you start to come down and you feel your hamstrings stretching, and that's what makes you do this instead, you know you got to work on that hamstring flexibility. So only work in the range that you can without the stick leaving your tailbone, okay? The next step is to add the knees into it. So you're going to still start the movement by bending at the hips and pushing your butt back, but then you're going to add that knee motion into the squat. And this is forcing me into a pretty good squatting pattern because I'm sticking that rear end back, I'm keeping my spine straight, and then I'm adding in the knee motion. So you can see from that side view, because I'm sticking my hips back and keeping my spine straight, my knees don't go too far forward over my toes. I'm in a good position. The thing you want to tune into is not too much folding over. So I don't want you looking at the floor, okay? You want to try to keep your eyes looking out in front of you as much as you can while you come down into that movement, okay? Then you take the stick away and work on it without the stick. Another option to learn that same movement pattern if you don't have a stick is to stand facing a wall. So if I stand close to the wall, like my toes right now are only, I don't know, maybe 3 or 4 inches away from the wall, and I work on my squatting like this, it's going to force me not to bend forward because I'm going to hit my head on the wall, and it's going to force me not to push my knees forward because I'm going to hit my knees on the wall, and it naturally brings you into that nice flat back squat without your knees jetting forward, without your chest bending too far down toward the floor. And if you wanted to, you could put the band around your knees for this as well to work on keeping your knees apart as you come up and down into that squat, using the wall as a tool to teach the movement. One other way to work on not letting the knees come forward would be to stand like in front of a coffee table or something similar and stand pretty close to it, because you can work on coming down into the squat and not letting your knees come forward to run into that coffee table. So coming down enough that you're pushing your rear end back, but you're not letting your knees jam into the table, okay? So I think that covers the different things we looked at in terms of the self-assessment. I'm gonna let Sarah open it up to questions in case I missed something that you really had a specific question about. So
I want to thank you for going to the wall, because I've made most of these people do the squat against the wall. See, it's not just me.
I have a question.
Yeah.
What if one side seems to be okay, but the other side is really wobbly, or, you know, very different from the other side?
Mm-hmm.
Is how much do you push the weak side, and how do you know which side is the weaker side? I mean, sometimes I think I'm not sure which hip it is that's having the problem. Uh-oh. Now I can't hear.
Right, it's on the patient one, like that's the weaker side. The wobbly leg is either weaker, the muscle truly has less strength, or the wobbly leg has poor neuromuscular control. Your brain and that leg are not communicating well. Your brain isn't telling that leg very well how to do it or how to control it. So when you're doing any of these drills, you want your brain power focused on that wobbly leg. You want to be looking in the mirror, or a reflection in a window, or having someone give you feedback, or videotape yourself, so you can watch and get your brain to learn how to control the wobbly leg. Usually the wobbly leg is the one that's weak with the clamshell motion. So definitely work on that one on the wobbly leg.
Okay.
Does that help?
Yep. Thank you.
Yeah.